What are the misconceptions that patients and families see about eating disorders? Number one is families, even if they love their wife, their mother, whatever, there's still a sense of, well, why don't you just eat? Or we we work hard, we bring food on the table, and then some families say, well, when I was a kid, I walked 10 miles through the snow and I had no food. But so one misconception is this is not being done out of spite. This isn't being done as an oppositional act. Now, of course, those things do happen, but with a real illness, this is real. And I like the families to know, again, education, what it is we can do for them. Another misconception is that it's not just about the eating, it's about the deterioration of your body. Your brain actually is affected. There's parts of the brain that essentially shut down. So, a common symptom with women that come in is they don't have a period. It's called amenorrhea. That's because a brain structure isn't functioning well. The other part of a misconception is that this affects so many organ systems. So I like to educate about things like the thyroid, the sodium, the potassium, how the liver can be damaged. I don't I don't get dramatic and talk about cardiac arrhythmias and death, but I allude to the fact that it's not just psychological, but it also deals with the rest of the body. Another misconception is, well, if can't you just feed her? And again, our patients at Remedy at this point are women, and we will grow. Just feed her and get things moving. There's something called refeeding syndrome. Think about this: the body in starvation mode has to almost like kind of recalculate its metabolic rate. So the women come in with a low metabolic rate. When you throw food at them too fast, they get refeeding syndrome, which means that all of the minerals are shifted, and they shift in a way that can damage kidneys, that can cause them to have seizures, etc. So that's something, again, patient education. The other misconception is, is there something wrong with their brain that they see themselves as fat? Well, the answer is, well, yes, but it's not a brain tumor. It's not assist or anything. We all look for simple answers to problems. So do I. When I'm home, I'm a father, and I probably ask the same questions because I'm human, and we're human, and that's who I appeal to.